also known as rabbit fever or deer fly fever, that has a great impact on humans and also animals, as it shattered not only their body, but mostly their lives, as this great villain strike its unexpected appearance. It is a rare infectious disease caused by Francisella tularensis that has an extreme infectivity and capable of infecting host cell types. Its main purpose was to attack mostly the skin, eyes, lymph nodes, and lastly, the lungs. Tularemia occurs in summer or most frequently during warm season, typically towards the end of summer. In US, most cases occurs in South Central states. Now, there are 6 major clinical syndromes which presents different clinical presentation that would help each one of us to identify and understand what areas are affected. Ulceroglandular. It is the most common syndrome that affects the skin, as it characterized by a painful swollen papule that turns to ulcer. Glandular. It presents with tender lymphadenopathy, commonly the axillary, inguinal, or cervical. It is mostly unknown infiltrate. Oropharyngeal. It affects the oropharyngeal mucosa most commonly by eating an undercooked meat from infected animals. The oculoglandular. It affects the conjunctiva, which is the portal of entry for the disease, and it is usually caused by direct inoculation from infected fingers. Typhoidal. Oops. It affects the oropharyngeal mucosa, which is through ingestion and respiratory tract by inhalation. It is a serious illness that often presents with septic shock. Last but not the least, pneumonic. It affects the respiratory tract, in which it has a high mortality rate.
Tularemia is a zoonotic infection caused by F. tularensis. It is a small, fastidious, aerobic, gram-negative coccobacillus. There are 4 distinct subspecies of F. tularensis. However, disease is mainly caused by F. tularensis subspecies tularensis, which is the type A, and F. tularensis subspecies, which is the Holarctica. Type A is more virulent and is primarily found in North America, while the type B is found throughout the Northern Hemisphere, mainly in Europe and Asia, and causes milder infection than type A. More than 100 species of mammals have been noted to be infected with tularemia. This includes rabbits and hares. Disease transmission can occur via handling the carcass of an infected animal, via the bite of an infected animal, or via ingestion of meat from a diseased animal. The bite of an insect vector such as tick, deer fly, or flea can also transmit tularemia to humans. In the US, ticks are the most common and important insect vector of tularemia. Tularemia can also be caused by contact with aerosolized bacteria from mowing lawns, working on farms, or working in labs. The disease can also be transmitted by drinking water contaminated with F. tularensis, and frozen rabbit meat has remained infected for greater than 3 years. Person-to-person transmission of tularemia doesn't occur.
Regarding prevalence, in the United States of America, during 2001 to 2010, a total of 1,208 cases of tularemia were reported. Tularemia is not known to be present in Hawaii. Also, the median number of cases per year was 126.5, with a range of 90 to 154 cases per year. Regarding age and sex, tularemia is more common in children and males. This is possibly because of a greater likelihood of exposure through hunting, where tularemia can be passed on through contaminated meat or passed by a tick itself, and even landscaping. The incubation period of tularemia, this lasts for about 3 to 5 days. This is before it becomes symptomatic, showing signs and symptoms just like headache, sore throat, and chest pain, and more.
I'll be talking about signs and symptoms and portal of entry of tularemia. After exposure to an infection, the first symptom will appear within 1 to 21 days, or average 2 to 5 days. In some books, it says 3 to 5 days. There are 6 major tularemia with different signs and symptoms and different portal of entry, like oral, skin, and respiratory tract. Let's discuss them one by one. The first one is the ulceroglandular tularemia. It is the most common, accounting 42% and 75% of all cases of tularemia. The portal of entry is through skin. This syndrome is characterized by painful swollen papule, and that becomes an ulcer. It's also characterized by a tender lymphadenopathy, or enlargement of lymph nodes. Fever and malaise are commonly seen. The second one is the glandular tularemia. The portal of entry with glandular tularemia is unknown, but most likely it is through skin. It is characterized by swollen papule that becomes an ulcer, and tender lymphadenitis that involve cervical, axillary, and inguinal lymph nodes. Oropharyngeal tularemia. The portal of entry is oral, caused by undercooked or infected meat. The infected person will experience severe pharyngitis, and cervical lymphadenitis that may suppurate and drain. Oral ulcers can be present and fever can be experienced. Oculoglandular tularemia. The conjunctiva is the portal of entry, and infection is usually caused by direct inoculation from infected fingers. It is characterized by nodular conjunctivitis, corneal ulcers, and conjunctival inflammation. Edema can also be seen. Typhoidal tularemia. The portal of entry for typhoidal is either oropharyngeal mucosa by ingestion, which is common among children, or through respiratory tract by inhalation, which is common among adults. It is very serious illness that often presents with septic shock. Headaches, myalgias, and pharyngeal pain are additional symptoms. Pneumonic tularemia is not
common in children. Type A francisella pneumonic tularemia is highly mortality rate and it is the severe form. Causes fever, cough, and chest pain. This may not look like lungs to you, but this is lungs that experience hilar adenopathy, pulmonary infiltrates, and pleural effusions.
Preventive measures for tularemia includes protecting yourself from insects using repellents, taking care when gardening or working outdoors to protect from any contaminated aerosol and such by using protective eyewears or facial mask. Taking precaution when dealing with animal carcasses or any animal in general with the use of gloves to avoid direct exposure. Make sure that any type of meat should be cooked thoroughly and not taken into the body raw or undercooked. Treatment of tularemia includes the use of antibiotics such as gentamicin and streptomycin, which are bactericidal antibiotics that work by interrupting the protein synthesis of the bacteria. Currently, there are no vaccines available to the public.
Moreover, washing hands is also the best way to prevent tularemia, especially after having contact with your pets. In the case of handling sick or dead pets, protective wearing is important. Like long pants, tuck into long socks, and long sleeves should be worn.
Tularemia can be difficult to diagnose. It is a rare disease, and the symptoms can be mistaken for other illnesses. Diagnosis is confirmed by isolation of F. tularensis in blood, body fluids, or tissue. F. tularensis is a fastidious bacteria that rarely is seen on gram staining. The bacteria grows best on culture medic supplemented by cysteine. Polymerase chain reaction PCR assay for the diagnosis of tularemia are very sensitive but are not commercially available. The white blood cells count may be a white predominance of neutrophils in children with tularemia. Chest X-rays finding in pneumonic tularemia may include pulmonary infiltrates, pleural effusion, and empyema.